The following research is brought to you by the Conscious Evolution Institute of Hormone Replacement Therapy. For more information, visit www.hgh.tv. Are you ready to start a program today, or do you have any questions? Fill out a contact form on our website and someone will be in touch as soon as possible. Bioidentical testosterone prescriptions. Prescriptions written for bioidentical testosterone triple in the last 10 years. Testosterone hormone replacement therapy is quickly becoming one of the hottest topics in endocrinology. As a result of new research and new methods of testosterone treatment, more and more people are turning to hormone testosterone in order to improve their health and their love life. Testosterone prescribed more often than ever. A new research study presents evidence that testosterone is being prescribed at a rate of 3 times faster than it ever has in the United States for male patients over the age of 40. 12 years ago, in the year 2001, only 0.81% of males in the United States utilized testosterone in any form. Today, that percentage has increased over 3% of males. Researchers find that there are many reasons why there has been such rapid increase in interest in this potent hormone. In the past 15 years, testosterone has become increasingly advertised in a manner which reaches directly out to potential patients. Most of these advertisements have been directed to males in their 40s and 50s during the period in which the symptoms of testosterone and the aging process are producing more and more of an effort on a man's life. In addition to this, more clinics are starting to specialize in areas of hormone replacement, aging, longevity, and general health and wellness, increasing the number of doctors and physicians that work heavily with testosterone and other hormones by virtue of their specialization. A third reason for this expansion is that testosterone HRT is becoming simpler and easier by the year as the new treatment methods become available in the United States. Testosterone debates rages on. Although the use of recombinant testosterone for hormone replacement has risen dramatically in recent years, the debate over the benefits and the risk of the treatment are hotly contested around the country. Testosterone replacement has been shown to produce some beneficial and potent changes in the human body. Bioidentical testosterone is proven to significantly increase muscle mass while reducing the fatigue associated with low decreased strength. In addition to this, testosterone vastly increases libido and sex drive in patients that are deficient in testosterone. Other studies, however, have shown that under certain circumstances, testosterone replacement can actually have a negative effect upon fertility and sperm counts in male patients. Also, there is mild correlation between testosterone hormone replacement therapy and prostate cancer that is being explored further in order to uncover potential hard links. At this point, evidence seems to suggest that testosterone treatments have a negative effect upon prostate tumors, but does not seem to increase the risk of development of new tumors. In any case, male patients that utilize testosterone should meet on a regular basis with their general practitioner in order to maintain proper health and uncover any negative issues before they become overly problematic. Testosterone and the lifespan. It is a proven fact that testosterone production slowly and steadily declines through the lifespan, but there is some controversy regarding exactly what level of deficiency should be officially declared low T. The scientific term for low T as well as testosterone deficiency is hypogonadism, referred to as an inability of the body to efficiently produce sex hormones. This deficiency is primarily defined in 2 ways: primary hypogonadism and secondary hypogonadism. Primary and secondary hypogonadism. Most male patients experience the former, primary hypogonadism, usually in the form of deficiency. The testes slowly lose their ability to effectively produce and secrete testosterone at a rate which averages around 2 percentage points every year, starting in the later 20s or early 30s. Some patients may experience this form of hypogonadism for other reasons, such as testicular trauma, however. The second, less common form of testosterone deficiency is secondary hypogonadism. This type of deficiency originates in the brain, usually from the pituitary gland and the hypothalamus, preventing the testes from getting the appropriate stimuli to produce hormonal testosterone. What is the threshold for low T? The most commonly agreed upon standard for testosterone deficiency is free testosterone level that is beneath 300 Ng, although the number may vary dependently upon the physician. If testosterone levels are beneath this threshold, then the patient will likely qualify for hormone replacement with testosterone. Testosterone research analysis. In the research that we mentioned at the beginning of the article, around 50% of patients that received testosterone hormone replacement therapy were treated after a hypogonadism diagnosis. A surprising piece of data is that nearly 1/4 of patients received no diagnostic testing in order to evaluate their hormone levels before they received treatment. Also, among the males that did undergo testosterone testing, it is not completely clear exactly how many of the patients actually suffered from low testosterone. Researchers explain that free testosterone production can be sensitive to many factors, including the time at which the test was administered. AMA opinion on testosterone testing. In recent issues of the Journal of American Medical Association, the researchers of this study wrote that additional examination is necessary in order to figure out exactly how many patients that seem to have testosterone deficiency are prescribed testosterone treatments, even though they truly have clinically normal levels of hormone. By evaluating this data, scientists hope that testosterone replacement can be prescribed more appropriately to patients that are truly in need. On the other hand, as our knowledge of testosterone hormone replacement therapy expands, we find that the threshold in which benefits outweigh risks is higher than we first suspected, in which case most patients will qualify for this treatment. Make sure low T symptoms are really the result of low testosterone. If you believe that you may be suffering from the symptoms of testosterone deficiency, it is important to rule out other potential causes of your symptoms before turning fully to testosterone replacement therapy. Dr. Liza, a New York urologist, explains that many symptoms that seem to be the result of testosterone deficiency may actually be due to other disorders that cause similar symptoms in the same stage of life. Although testosterone replacement can be an effective tool to treat the symptoms of the disorder, if testosterone deficiency is not your primary medical issue, you may simply be covering up other underlying health conditions. Dr. Liza also claims that for many patients, the other common treatments for erectile issues are likely better for patients that do not suffer from a legitimate deficiency of testosterone. Testosterone research data source and qualifications. The data for this study was obtained by the files of a large health insurance provider, and the data set included over 10 million males over the age of 40 in order to determine the exact number of patients utilizing testosterone replacement products. Of course, the data set obtained for this research cannot be used to provide a complete view regarding what percentage of males use testosterone, because access to testosterone through private health insurance is not fully predictive in revealing the number of patients without health care or the number of patients with public insurance through Medicare that choose to turn to testosterone. Hormone replacement therapy, the future of medicine? In the end, the researchers feel that more testing is needed in order to examine testosterone HRT in order to maximize the effectiveness of treatment while limiting the number of patients that receive the therapy when other treatments may be more effective at safely improving their healthcare situation. There is no doubt in many coming years our knowledge about pros and cons of testosterone hormone treatments will increase tremendously. Stay tuned for more informative videos next time, brought to you by the Conscious Evolution Institute of Hormone Replacement Therapy. For more information, visit www.hgh.tv.